Welcome to Career Journeys, a series of videos by the Consortium for Public Education. Here we explore the career experiences and pathways of professionals from a wide variety of careers to help you think about the skills you'll need and the paths you might take after high school.
Hi folks, I'm Aaron Aldemus, a program director with the Consortium for Public Education. Today I'm interviewing JD Waechter, a health science professional, as part of our Career Journeys video series to share highlights into a professional's pivotal experiences and career pathways. Thank you for joining us.
Thanks for having me, Aaron. Appreciate it.
So JD, tell me about your company and your role there. What do you do as a practice manager?
So I work for Allegheny Health Network, or AHN, you may have heard. As a practice manager in this role, really what I do is help organize the doctor's offices, and specifically we have specialized teams that we're bringing into these doctor's offices in the last few years. So right now I practice manage what we call chronic care clinics that were focused on helping particular diseases amongst patients.
Did you always think you would be a practice manager?
No, I never knew that would be where I am today, to be very honest. So I actually walked into my career as an exercise physiologist. So it went to IUP for my undergraduate schooling. I went to Pitt for my master's, and those were both around what's called exercise science or exercise physiology. And over time, gained skills around different chronic diseases, which is very ironic and nice to see the coordination of what that was and where I'm now working.
What were some of the other occupations you had before you became a practice manager?
When I started my career in 2010, I first started at Jefferson Hospital, which is now a part of Allegheny Health Network, and which is how I evolved into this role, was through the coordination of that hospital and now AHN. But ultimately, I worked in cardiac rehab, pulmonary rehab, and other specialized programs that we had available down there at that time. And I really kicked off my career as I thought I would, leaving school as an exercise physiologist. And what we do is really specialized personal training. It is for cardiac patients, pulmonary patients, those that have had interventions or surgeries or diseases that have progressed to a point where it affects their daily life. So we were able to help increase stamina, increase endurance, increase education and understanding on how to help patients really pursue life with this newfound disease, newfound issue, newfound situation that they were presented, whether it be something progressive over a period of time, like a patient with pulmonary disease over many years of their life, or someone who may have just woken up one morning or in the middle of the evening and unfortunately suffered a heart attack, for example. What
kind of advice would you have for high school students who are interested in getting into your field?
Yeah, looking back, I remember how difficult it was in high school to want to do more. I remember that. I remember that very distinctly. I was a drummer. I still am. I like to play on my drum pad every so often, but that was the more that I had then. That was my extracurricular. And I just remember a lot of friends who maybe didn't have that extracurricular and they weren't always into the something extra. I think that's okay. You don't need to have that extracurricular in high school, but my point here is that looking for something that does make you happy and does apply your interests is probably what's most important, because if you find that it's not what you're interested in, then you can move on to the next trial. You could try something else and continue to find things that you may end up liking in the end. Outside of that is just to be open and understanding that this is the beginning of a very fun, long, and sometimes difficult journey, to find out what it is that you will be doing for the rest of your life. You may never know. I still don't. I feel like I started in one career path and I'm still in the healthcare industry, of course, and I don't see that changing, but where I end up in the healthcare world is, we'll have to wait and see. So being open to trying new things and staying very pointed at trying to learn. I think one of the best things that you could focus on is trying to adapt your learning skills and really honing in on the different bits of information that exist.
It sounds like you're suggesting for high school students to really get in and try new things. But when students are looking at post-secondary, so training after high school, what are some specific recommendations you might make in order to kind of prepare for where you are now?
I first went to college to be a chemist. I thought the chemistry was fantastic. I thought it was really neat. I thought that CSI, crime scene investigation, that was the big thing back then, and I loved it. And I thought forensic science was awesome. While I think I could have done it, I just wasn't that into chemistry, it turned out, and went on to try something new, which was math. And I've always loved math and did well with it in high school. Ultimately, I mathed myself out in college. I had an entire semester trying to catch up from missing out on the first year of chemistry adjustments. And when I tried that catch up, I just got mathed out. And ultimately, I almost left school at that time. I was very close financially to not come back to IUP. So I had to make some hard life decisions and had some hard life conversations with my family. And ultimately, it came down to what's best. And I looked at my past and even current state. I was in the drum line at IUP. And I took that into consideration. I said, what do I love so much about some of this, besides making the music and having the experiences with my friends? And my answer was the body engagement and the work that I did to march on a field. It's the work that I did with my body. And I just really enjoyed that. And that's what led me to exercise science. And from there, here I am. I think that the integration of chemistry to math to then exercise science, it makes sense in some ways because I always had that science underlying theme going on there. And the fact that I ended up putting one of my true passions in drumming and performance to one of my true enjoyments in the sciences, which is health, and put those together in this world, I couldn't have been happier with how I ended up in that situation.
JD, for students who maybe were in a similar position as you were when you were in college, are there other questions you would recommend that students really kind of ask themselves to reflect on, like, is this health science pathway the right pathway for me?
If health in general, and whether that be medicine or exercise physiology, for example, or other areas of health sciences, I think I'm comfortable collecting them together now that I just pieced that together. I think you have to truly be able to be an empathetic individual. When it comes down to it, we are humans helping other humans day in and day out. And if you are ready to do that, if you're ready to commit to apply that empathy and to apply your knowledge to helping someone else, and it's not always the easiest, but it's always not the most difficult. I think that that's the beauty of the role in health sciences, is that you have some of those situations that just click, and then you have some of the other situations that you really, really have to work at. So bringing it together, if you can admit to yourself that you're an empathetic individual and you're willing to stay to that, and that you're willing to commit to the hard times, I feel that you're in it to win it.
JD, for young people who are interested in going into your field, what advice would you offer them?
I would say that the more experiences you can gain, the better off you're going to be. And that ties into some of the other themes, I think, that we've talked about here. Exposure, learning, seeing, asking questions, and doing are all really integral pieces for you to be comfortable in moving on, are really the best things that you can do to help take the next steps for yourselves.
JD, thank you so much for sharing your experiences and thoughts with me.
Thanks so much.
For more information or to learn about other careers in the Career Journey series, visit our website and check back soon for our next installment. Thanks!